Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, I'm going to be demonstrating how to give a PO, so by mouth, medication. So the first thing we do is look at our MAR, our medication administration record, and it could be either a paper one or one on the computer, it doesn't matter. You're going to be making sure you have the right patient, so be checking their name, their date of birth, their medical record number, any allergies that are listed. And then you're going to look for the meds. So what are we looking for when we look at the meds? We're looking for the name of the medication, the way it's going to be given, so in this case by mouth, so it'll say PO, the time it's supposed to be given, so when is it due, the amount we're supposed to give, and then when we're all done, the final right is documentation, so we'll do that. So the first check is we're checking everything out on the MAR, making sure it all looks correct. So we'll say, yes, it looks correct. Now our second check will actually go and pull the medication out. So what we're going to do is we're going to compare the medication to what it says on the MAR, making sure everything matches up. Also on the medication, you will notice an expiration date. Obviously, if it's past that expiration date, you're not going to give it. You're going to want to get a new one. So we'll say, yes, everything matches up and the expiration date is good. So that's our second check. The final thing is we're going to go into the room and actually give it to the patient. Now we've entered the room, knock, 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 hand hygiene, provide privacy, and identify the patient with two identifiers, name and date of birth. Now that we've done that, we're going to do our third and final check. So comparing the medication once again to our MAR, making sure everything matches up and is good. Now we're going to ask our patient, do they have any allergies? And if they say no, okay, we're good to go. If they say yes, I'm allergic to penicillin, we're going to ask them, oh, what happens if you were to get penicillin? Because you need to know the reaction. You need to know, is it like a mild reaction? Is it a life-threatening reaction? Or are they confusing an allergy with a common side effect? Because sometimes people do that. Sometimes people say, oh, if I take that and I haven't had anything to eat, I get nauseous. Well, that's not an allergy, right? That's a side effect. So you want to ask, do you have allergies? And if they say yes, what happens to you if you were to receive that? Even if that's not something you're giving, you want to know that so you can document that for the future. So we've done all of that. Everything's been checked out. Mr. Jones doesn't have any allergies. He's okay. Everything's good. Now we're actually ready to give the med. So I have yet to open it. I have my little cup here. I'm going to put it in the cup, but I haven't opened it yet because I want to let him know what I'm giving him. Because if you were to open it and then explain what it was and they go, oh yeah, I don't want that. Well, now you got to go waste it, right? So you want to explain what it is before you open it. So Mr. Jones, this is your Colace. It's a stool softener. It's not a laxative. It's not going to make you go to the bathroom. It's just going to make it easier for when you do have to go to the bathroom. Do you want to take this medication? And it's like, yes, that's fine. Then you can actually open it and put it in the little cup. Here you go, Mr. Jones. And give him this with, a sip of water. Okay, do you have any questions for me about this medication? No? Do you need anything else from me right now? No? Okay, here's your call light. I'll be back to check on you in a couple of minutes. So that was my video on how to give PO medications. Not the most difficult skill in the world, but it's not supposed to be difficult, right? You just want to make sure that you're doing all the correct things and you're being safe. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.